Greetings and congratulations on your newborn baby. We are so happy for you and your family. My name is Dr. Ragu, like the pasta sauce, and I am a pediatrician, and I am here to help answer your questions about your newborn while in the hospital. For all newborns in the hospital before going home, our nurses will perform a hearing test, check routine bilirubin levels screening for jaundice, and obtain a newborn screen that tests for genetic concerns sent to the Mississippi Department of Health. The newborn screen takes about 1 to 2 weeks to be finalized, and thus it is important your child's primary care doctor follows this result. It is necessary that we know who your child's primary care doctor will be when you go home. All newborn babies should follow up for weight checks to ensure excellent growth and healthy development. I would like to review some important teaching topics about your newborn before you go home as well. First of all babies do 5 things. They eat, sleep, poop, pee, and cry. That's it. So let's go ahead and get started and go into a little bit more detail. First of all, feeding. Babies need to eat very often because their tummies are so small. You can see within the first 24 hours, your baby's stomach is actually only the size of a small grape. By the time we're 3 days old, it's the size of a little cherry tomato, and by the time we're a week old, it's the size of a little apricot. But that's still really small, and that's why newborn babies need to eat every 2 to 3 hours around the clock, including feeding at night. Babies will take more volume when they get older. But early on, that little tummy can only take so much. And so when it's filled up all the way, that's when we see that reflex come right back up. And that is very common. In fact, nearly 100% of babies have some degree of reflux. We burp babies after we feed them because they swallow a lot of air with feeding, and burping helps get out some of that extra air, thus allowing them to keep it down a little bit better. Babies will eventually sleep through the night between 4 to 6 months old, but they will need to feed at night as newborns right now with those small tummies. Breast milk has tremendous benefits for you and your baby. It has benefits as far as brain development as well as immune system support. Breastfed babies get sick less often than formula-fed babies. You always have your breast milk on you, and you don't have to worry about preparing formula. Your breast milk has all your baby needs for the first few months of life for food. Nonetheless, our priority is to support our mothers for whatever works for you and your family. Breastfeeding is hard work, and we're here to support you with your goals no matter what. We have resources for breastfeeding mothers, including helping connect with a local lactation consultant, as well as 24/7 breastfeeding support with an app known as the Pacify app, available to all mothers with WIC free of charge. For mothers interested in breastfeeding, it is important that you know that the breast milk takes a few days to come in. Most often, the breast milk really comes in after 3 days or so, typically, by the time most mothers get home from the hospital. It is really important, if you want to breastfeed, that you need to put the baby at the breast or pump before every feed in order to stimulate the milk supply. If we do not do so, then we risk having decreased milk supply or losing it. If you do not use it, you lose it. So very important. For formula, it is important to note how to safely prepare and store formula. Most formula brands have the ratio of 1 scoop added for every 2 ounces of water. Improperly preparing formula can be harmful to your baby. We have lots of information about this for you. Babies need only formula or breast milk. Your pediatrician will discuss when to add baby cereal or baby foods, which is typically between 4 to 6 months old for infants. We do not give babies straight up water until after they're 6 months old. Now, talking about poop. Poop can be all the colors of the rainbow. We start with the black poop, which is called meconium, but then the stool can transition to the other colors that can all be normal, such as the brown poop, green poop, and yellow seedy poop like mustard classically. Your doctor should know if your baby's poop has any red color that would be concerning for blood. Furthermore, if the poop is ever pure white like a piece of chalk, then that could be a real gallbladder concern, and you should reach out to your doctor if that is the case. The number of poops can vary. Some babies are pooping 10 times a day, and other babies can go several days with only one poop. So as long as we're pooping, we're okay. Talk to your pediatrician for tips and tricks on constipation if we're having concerns. Next are the pee diapers. Pee diapers are very important. That's how your baby communicates that they are hydrated. On average, a general guide is that typically a baby has a minimum of 1 pee diaper on day 1, 2 pee diapers on day 2, and so on. By the time we're a week old, we want to have a minimum of at least 5 to 6 pee diapers per 24 hours. Oftentimes, it can be 8 to 12 pee diapers per 24 hours with every diaper change. If we're over a week old and for some reason we're only having 1 pee diaper in a 24-hour period, then something isn't right. The doctor should be informed. Next, we talk about safe sleep. For all our babies, we talk about the A, B, C, Ds of safe sleep. A baby should sleep A, alone, B, on their back, C, a crib, bassinet, or pack and play, and D stands for don't smoke around the baby. For A, alone, that means a baby should sleep by themselves. It is okay to swaddle your baby carefully, but no extra blankets, stuffed animals, or pillows. A baby can sleep in your arms if you are alert and carefully paying attention, but the moment you start to feel asleep, it's very important you carefully move your baby to their own safe sleep space. A lot of parents might think, oh, my baby is so cozy and cuddly. Can they sleep with me? The answer is no. Unfortunately, mothers have rolled on their babies, even if they think it would never happen to them. I often say if a child is going to be in the same bed, they have to be old enough to say, Mama, get off me, and be able to physically push you. Obviously, a newborn cannot do that. B is on the back. For any of us, if we're on our tummies, we could easily turn our heads, no problem. But babies do not have the head control to do this well. Thus, it is safest for your baby to always sleep on their back, not on their tummies or on their sides. When your little one is awake with eyes open, it is encouraged to do some tummy time when you get home for 3 to 5 minutes at a time, several times throughout the day for some good exercise. That's how your baby will learn how to crawl eventually. But for now, always on the back when sleeping. C is the crib, bassinet, or pack and play. We must have a safe sleep space for your baby before you go home. A newborn cannot sleep on your bed or on the couch because the bedding or the material is not safe and may be dangerous. Please let us know if you have any concerns and do not have a safe sleep space for your baby before you go home. D stands for don't smoke around the baby. It is best for anyone who smokes at home to smoke outside for the safety of the baby. For anyone who smokes, they can wear a smoking jacket on top so that the debris won't get on the clothes. Alternatively, the shirt can be changed before holding the baby. That way, the baby will not be impacted from any of the cigarette smoke debris. We encourage all family members interested in quitting to give the Mississippi Quit Hotline a call, which is 1-800-QUIT-NOW, to get help from experts. Last but not least, crying and maternal health. Babies cry a lot. They cry when they're hungry, they cry when they're sleepy, they cry when they have a dirt diaper, and sometimes they're crying just because they gotta cry. It's how they communicate. We share the same message for every family. Whenever we're feeling stressed, it's okay to take a minute for yourself. If you need to go to the bathroom or get some fresh air, then return in 10 minutes. That's okay. It's important that we never, ever, ever shake a baby if frustrated, because that can cause brain damage. Furthermore, for all mothers, it is important to note it's a huge change in hormone levels for when a baby is inside you to a baby being out of you after the baby is born. Those hormones can cause feelings of feeling sad or down, even when you're feeling so happy with having your brand new baby. We're all on your team, and there are so many resources to support our mothers out there. Healthy moms equals healthy babies. Please reach out to your doctor or your baby's doctor for more information on resources to help you as well. As we wrap up, we have a few more final points that we'll go over. Your baby's umbilical cord will fall off on its own within the first few days to weeks. We expect that it should fall off by about 3 weeks of age. We want to keep it dry to prevent any infection. Thus, there's no need to apply any alcohol or peroxide, as we want it to dry out and fall off on its own. It'll fall off faster. Please hold off on a baby bath until it falls off completely. Rather, just use a little washcloth to wipe off any spit up on your baby. Fevers can be very serious in a baby under 60 days old, and your child's doctor must be informed if we ever have those concerns. A temp of greater than 100.4 degrees Fahrenheit or higher is a true fever. The most accurate way to check a temperature in a baby is actually at the bottom by a rectal temperature. Just insert the thermometer just slightly into the rectum. Don't worry, it won't hurt them. If anything, they may have a little bit of a small bowel movement potentially afterwards. But just stick the thermometer gently in the rectum to assess the most accurate temperature reading. Contact your doctor if we're ever concerned or see a temperature greater than 100.4 degrees Fahrenheit if it is before your baby has got their first immunizations. Finally, last but not least, while being a parent may be the toughest job in the world, it is the most rewarding. We are here to support you and are on your team. Please reach out to your nurses and pediatricians for any questions that you have while in the hospital. Thank you so much, and we are looking forward to supporting you throughout this journey.